Hi, I'm Jon Bergeron, and I have the privilege of talking to you today about trauma and the deaf child. This is a topic that's important to me on a couple of different levels. Professionally, I'm a clinical psychologist, and I specialize in working with foster and adoptive families and really help families tackle the problems that come along with trauma. And I'm also an adoptive dad, and so I've got two boys that come to us through adoption who are profoundly deaf. And so this is a place that I've learned a lot, both experientially and academically. And so I hope to share some of that with you today. So let's start with a definition of trauma. I like to start with a simple definition that captures the center of what trauma really is. And trauma is the experience of a distressing event that overwhelms an individual's ability to cope. And so this explains why two people can go through the same event and one experience trauma and the other not. Because it's linked directly to the coping abilities of that individual. And what we know about children is that their ability to cope with stress is less than that of adulthood, and so kids are far more easily traumatized than adults are. Some of the key points or aspects about trauma are that traumas are typically a dehumanizing or shocking or certainly a terrifying event. They can come either in a singular event or multiple events. And when there are multiple events, they tend to compound in terms of their impact over time. One of the things that clinically I discovered as I began working with folks with trauma was that often one of the most painful parts of trauma was this sense of betrayal that came not from the person who abused them, but from an individual or people who were supposed to protect them. So the other parent who didn't save them from the abuse, or the institution that was supposed to protect them. And so this sense of betrayal is often a core component of trauma. The last component I would like to highlight is just this idea of a lack of safety. And this is one of the most destabilizing aspects of trauma, in that it's not just a thing that increases anxiety, but trauma takes away an individual's sense of safety in the world. They go from living in a world that seems safe and secure for the most part to living in a world that's constantly unsafe. And that has a profound impact on their functioning over time. So let's talk about trauma in deaf children in particular. One of the tough things about statistics around this is that the research on childhood trauma in the deaf community is really limited. So we don't know a lot. When we widen the perspective a little bit, we do know that children and even adults with all kinds of disabilities are far more likely to experience some type of trauma or abuse due to that disability. When we look specifically at deaf kids, what we see is that with emotional abuse, they're at least twice as likely to experience that, and up to 4 times the risk for physical abuse. When we look at sexual abuse, 50 to 54% of deaf kids have experienced sexual abuse, compared to only 10 to 25% in hearing kids. One of the reasons for this certainly historically has been the larger number of deaf kids going to institutional schools. And institutions are always at a higher risk of different types of abuse, particularly sexual abuse. And so this is one of the reasons we probably see this higher number. But as an educator, it's important to understand that this population is going to have a higher amount of abuse and the subsequent effects of that you see. One of the things that's unique about deaf kids is that they very frequently experience language deprivation early in life due to the fact that the vast majority of deaf kids are born into hearing families. And so they don't get the typical early exposure to language that hearing children get. And this leads to a disfluency in their language that affects trauma and how it affects them. One of the things we see is that language disfluency itself leads to an increased vulnerability to trauma by making kids an easier target. Those who target children for abuse are often looking for an easier target who's less likely to communicate about what has happened or what may happen. And so this is why they target those kiddos. Secondly, deaf individuals with language deprivation often don't develop the social skills and the emotional skills that help prevent traumatic events from happening, and also decrease their resiliency in bouncing back from the effects of trauma. And so we see a greater impact for that trauma in deaf individuals. Another aspect that's unique to deaf individuals is a thing we call information deprivation trauma. And what we mean by that is this is the effect that occurs when a traumatic event happens and the information or knowledge about that event is limited. And this causes that event to be more traumatic. And some of the contributors to that are a lack of foreknowledge about significant events. If we're talking about hurricanes or earthquakes or other natural disasters, a deaf child will often have a less amount of information about what that means and what's likely to happen due to that lack of incidental learning that occurs through language. And so this makes trauma more traumatic and have a greater impact. Secondly, they often experience a lack of access to communication about what's going on with people that are important to them, their loved ones, their friends, their family. When bad things are happening, they often become more worried, and because they don't have as much access to information, it's scarier for them. And so they experience more trauma as a result of that. And finally, we often see families attempting to protect deaf individuals, particularly deaf children, by not sharing information they would see as stressful to them. But in the end, that lack of information is often more stressful for them and causes more distress and ultimately more trauma. The other thing I wanted to share with you guys about trauma is that trauma occurs over the course of a lifetime. And most people understand that trauma can occur very young and in childhood and teenage years and adulthood. But actually, we know from research that trauma can actually occur in utero before a baby is even born. Stressful events for the mother can translate into traumatic effects in that child as that child develops. And we see a lifelong impact of even prenatal trauma in kiddos before they're born. Certainly, there's also trauma that occurs during birth when there's a difficult birth and there's medical complications. We see the effects of trauma lasting throughout childhood and into adulthood from those kinds of traumas as well. And certainly infancy and childhood, when children are harmed in different ways, this causes trauma. Sometimes it's intentional harm. Sometimes it's things like medical issues, surgeries, stressful events that are even for the child's well-being. But when they create distress in a child, it has a traumatic effect. And this lasts on into adulthood. One of the things to remember about the developmental impact of trauma is that a young brain is far more vulnerable to the effects of trauma than an older brain. The developing brain shapes itself around experience. And so when a child experiences trauma, the brain is shaped by that. And we're going to talk more about that in some upcoming slides. The other thing I'd like to just kind of start with here is just understanding that trauma doesn't just impact a child's feelings and emotions or their behavior. It actually impacts the entire being of a child, from their brain and their brain development to the way their body functions. It certainly affects relationships in very significant and deep ways. It absolutely affects behavior and emotions and even the way that they learn. And so understanding all of these factors and places in which trauma impacts a child is important as we seek to serve kids with trauma well. So let's dive in a little bit and look at how trauma affects the brain. And what I want to start with is just kind of an overview of the brain. And what you see in this diagram is the brain from the side, and the blue part is on the front. We call that the frontal lobe. And what you see is the main areas in the brain that are impacted by trauma. The blue and yellow together are what we call the frontal lobe of the brain, and that sits right over your eyeballs. And it has some really important functions. It does things like inhibit behavior. So when you have an impulse, it stops you from doing dumb things. It also helps you start behaviors that you need to do, which we call initiation. It's really important in terms of planning. It's important in terms of focus and attention, and a number of other brain activities that are really critical to functioning are impacted specifically by trauma, and we know that. The other two areas there that are in green and red are called the amygdala and the hippocampus. And these are also really key structures in the brain. The amygdala largely functions in the emotional realm. It manages and really evokes a lot of emotion, particularly the emotions of anger and fear. And so these are uniquely, as you would expect, impacted by trauma. Right next to the amygdala is what's called the hippocampus. And the hippocampus is primarily active in terms of learning and memory. And this is an important brain function in terms of those two structures being linked and right next to each other, because for survival's sake, we want to remember the things that create fear, that represent danger for us. And so when the amygdala gets lit up and is activated through a dangerous, fearful situation, the hippocampus is triggered to remember that, and so that for future situations, the individual can remember that. So that's a quick overview of the places in the brain that are uniquely affected by trauma. And as we go through some brain scans, I think it'll make sense as we talk about how those different parts are affected. So this first scan looks at the electrical activity in the brain. And this is called an MEG, or a magnetoencephalography scan. And what you see on the left is a person who's been diagnosed with active PTSD, meaning that they have active symptoms ongoingly of post-traumatic stress disorder. And on the right, you see the scan of a person without trauma, without PTSD symptoms. And this is basically a scan of a resting individual. So they lay down and are put into the scanner and said to just chill out. We're going to take a picture of your brain, and then they're done. And so in that context, what you should see is a brain with very little activity in it, because they're just resting and there's no visual input. Nobody's talking to them. They're just laying in the scanning machine. However, what we see in this person with PTSD is a very active brain. And this represents how their brains are often functioning even when they shouldn't be. That their brains often can't calm down. And so there's high levels of activity and high levels of arousal, even when the situation would call for calmness or relaxation. The second scan I wanted to look at is from a chemical perspective. And so this is a PET scan that looks at the amount of serotonin in particular that's being used in the brain. And so on the left, we see a person without trauma, and on the right, a person with active PTSD with trauma. And what you'll see is a lot of activity in the orange and red areas of serotonin. And serotonin is a chemical that has to do with sleep. It's particularly important in mood regulation and also in learning. And so what we see with individuals who've been through trauma is that it changes the chemical functioning of the brain in such a way that serotonin is far less active and less present. And this leads to a number of different symptoms that occur as well. The last scan I wanted to show you is a structural picture of the brain. And so this is what we call a static scan. So it's just like an X-ray, basically. It's a CAT scan. And on the left is a normal, typical person without trauma. And on the right is a person who's had chronic trauma for many, many years. And what you'll see overall is a shrinkage of the brain. So the dark area is just fluid, and the lighter areas is brain tissue. And you'll see on the right, this person with trauma overall has less brain volume. And down at the bottom, you'll see is a zoomed in area that's pointing to the hippocampus in particular. And that outline there is that structure I talked about earlier that has to do with memory and learning. And look how much smaller it is in the person who's had trauma. And so this, is kind of evidence directly from the brain about why people struggle with memory, particularly new memories and new learning when they've had trauma in their background. And so all three of these scans I share with you because I want to really drive home the point that trauma is not just about feelings or emotions or ways of thinking. It's literally, it changes the structure of the brain. It changes the functioning of the brain, the way it functions electrically, chemically, and even the structure. And so my hope is that in understanding this information, we have a lot more compassion for kids, because I think that the right way to look at this is the fact that they have damaged brains as a result of that trauma. Now, the good news is that it can get better, and we're going to talk about some of the ways that that can get better. And the earlier the trauma is identified and dealt with, the more healing and recovery can happen. So we just talked about trauma's effect on the brain, but I also want to talk about other parts of the body that are impacted by trauma. And I share a quote here from Bessel van der Kolk, who is a famous researcher and author around trauma and its effect on individuals. And what he says is that there's an increase in just about every medical issue over time. And that's what the research shows, is that when we look at almost any physical problem or disease process, it's worsened when you have trauma in your background. And so on the right side of the slide, I show a diagram of just some of the major areas that are affected by trauma. One of the key things is that hormone levels are changed, particularly those stress hormones that we call cortisol and adrenaline are released far more often and more chronically in individuals with trauma, and that affects the whole rest of the body, because that's what hormones do, or they're kind of control chemicals of the body. We also see a lot of GI, so stomach and gut issues in individuals who have trauma in their background. A lot of chronic irritable bowel syndrome and Crohn's disease and things such as that is much higher in individuals who've had trauma. We talked about the brain structure and functioning changes, and cardiovascular, so the heart and the lungs and the blood vessels are all impacted by trauma in negative ways. And so we see a lot more heart issues and circulatory issues after trauma. One other area that I'd like to mention too that probably is probably most widely impacting the body is the immune system. We know that the immune system is radically impacted by trauma, and that ends up affecting all kinds of things, including later development of cancer. And so the point here being is that clearly trauma is not just something that's a psychological phenomenon. It has a very direct impact on our whole body, including our brain. Another area that trauma has a significant impact is on relationships and a child's ability to both form and maintain and have healthy relationships. And so in this slide, I list a few of the different types of things we see in individuals with trauma that can create problems in relationships. One of the things that's particularly challenging, and as a parent of a kiddo with trauma, I can tell you that the high need for control that these kiddos have is really challenging, because they like to be in control and they don't like it when other people are in control, like their parents or a teacher. They also tend to have a lot of anxiety and nervousness and worries, fears. They can be really irritable. They can have a lot of what we call hypervigilance. So they're constantly scanning their environment, looking for what might be threatening to them, and often misperceiving things that aren't dangerous as dangerous or threatening, and react as such. They often end up feeling very victimized, even when no one's victimizing them. In a situation such as, even just playing a game and they lose that game, they feel as if it was intentionally done to harm them. And so you may get a very intense and sometimes physical reaction to everyday kinds of situations like that. You also see a pattern of sabotaging relationships. And so for individuals who have trauma in their background, a trusting, safe relationship actually can be a dangerous thing, because they've often been harmed by people that they should have been able to trust. And so as they start to form trusting relationships and bond with individuals, it can often trigger that fear, and then they will act out in ways that actually destroy and sabotage that relationship. One of the ways that happens is they will often withdraw and pull out of a relationship and begin distancing themselves. They may be actively aggressive toward other people that they feel threatened by, or that they feel victimized by. And other kids will often just resort to passivity of not having opinions, not making choices, just being kind of sluggish in their response. Or another strategy you see is people pleasing. So kids may revert to just telling people what they want to hear and doing what people want them to do while people are watching, but then often not really doing it for the right reasons. And so all of these things can have significant impacts on a child's ability to have those relationships that are actually part of the healing process for them. Another area that trauma has a major impact on is emotions. And we can see a broad range of impact. And in some people, sometimes it tends to create a higher level of reactivity to situations. So a small stressor might create a really intense reaction in a kiddo. On the other end of the spectrum, we often see kids that have a kind of an underreaction. And so they may have a major thing happen, such as getting hurt, and they don't really show much, if any, emotion about it. And that can be a problem because our emotions serve a helpful and healthy function. And when they have low reactivity, that can often be just as problematic as overreactivity. Often what we see with folks with trauma is a focus on escaping emotion, because emotion is often seen as very unpleasant and painful. And so a lot of behaviors will develop to get away from those emotions, such as distracting themselves and sometimes diving into hyperactivity of different sorts and distraction. We also see a tendency to numb emotions, and numbing can occur with technology, certainly. Chemicals can often be good numbers for emotions. So older kids will often get into alcohol and drugs as a way to try to cope with the intense emotions that they experience. One of the things that we see in general about emotions in folks that have experienced trauma is that the negative emotions predominate, that they may still feel positive emotions like joy and happiness, and excitement, but they experience far more of the negative emotions like sadness and shame, things like anger and anxiety. They often fall into despair and feel a greater sense of disgust, often about themselves. And so these negative emotions are far more present and predominant, and often lead to other mental health issues like depression and anxiety. Another significant area I want to talk about is how trauma affects behavior. And this is often one of the more problematic arenas that we deal with kiddos with trauma, particularly in the school environment, because trauma can often increase the amount of aggression that we see in kids. And that aggression can be directed at others, toward other children, or toward even adults in situations. And it can also be directed toward themselves in the form of self-harm or even suicidal behavior. And so aggression tends to be one of the more stressful events for the adults involved that are responsible for a child's safety and for the children around them. And so that's a significant challenge in working with these kiddos. Connected to that is also the finding that kids with trauma tend to have very poor impulse control. Impulses are a part of life, and we all have them, but we all have our frontal lobes to help us filter through what impulses we allow to translate into action and which ones we shelve, usually because they would have some negative impact for us. These kiddos have a much harder time filtering out the bad impulses from the good impulses, and so they often get themselves in trouble. And often, when asked why they did something, will tell you, I don't know, because they often don't. It's just an impulse that they didn't control well and turned into some problematic behavior. We often see a lot of risk-taking as well in kids with trauma. And so you may have little kids that are jumping off the top of the playground set, or being excessively rough when they're playing kickball or football or something like that. And as a result, we see much greater frequency of different kinds of injuries due to accidents in kids with trauma for this reason, typically. Another thing we see is social withdrawal. And so kids with trauma will often pull away from relationships. They'll isolate themselves from peers. And this is often because they've experienced a lot of difficulty in those relationships. Relationships can be very painful and stressful and scary for them. And so they end up taking the easier way out of just withdrawing from those and creating distance with people in their lives. As kids get older, one of the things we see is a tendency to seek out substances, probably often in terms of that numbing that we talked about earlier. That kids start using alcohol and other drugs much earlier when they have trauma in their background. Another aspect of that is they're often exposed earlier to those kinds of things as well, because drug and alcohol use are a frequent contributor to abuse in home environments. And so they tend to be more familiar with that and often have more access than kiddos that have not experienced trauma. The last one I want to talk about is particularly challenging and troubling for a lot of adults dealing with kiddos, and that is sexual acting out. And certainly kids who have been sexually abused will act out more often sexually as they try to make sense of what's happened to them and what they've been exposed to far too early in life. And sometimes even kids with other types of trauma, because of the impulsivity and the anger, will often act out in sexual ways, even if they haven't had sexual trauma specifically. So all of these are some challenging behaviors that we see pretty commonly in kids with trauma in their background. Now we're going to talk about an area that is particularly relevant to the school environment, and that is trauma's impact on learning. One of the things that the research shows is that trauma really has a profound effect on language development. And so as children learn both spoken and written language, the trauma affects the parts of the brain that process that. And so language and language abilities affect all parts of school. And so this creates a lot of difficulties for kiddos as they go through school. And all of these things are generally independent of their overall intelligence. And so you'll often see very smart kids, very bright, struggling in areas academically. And that's often a result of the trauma and how it's affected their brains. Another area specifically that's affected is the ability to focus and pay attention, which obviously is a big part of school. We want kids to be able to sit for at least a little while, pay attention to what their teacher is saying, what they're reading in a book, project they're working on. And these kiddos really struggle to maintain that focus and attention long enough to learn what it is they need to learn. This often looks very much like ADHD. And so a lot of kids with trauma are misdiagnosed with ADHD because they also show problems with hyperactivity. But often that the fundamental deficit in attention deficit disorder is not the same as trauma, but it looks very similar. And it creates problems in the school environment. Another major area we see is the ability to retain information or memory. So trauma decreases a kid's ability to hold on to the information they learn. And this is one of the things that we saw in one of our foster kiddos who was a really bright kiddo and would learn what they taught at school and would come home and be able to do the homework. And then the very next day, the teacher would say she forgot it. And, we'd see that at home too, as we're working on something she knew the day before, she was unable to do it the next day. And that's something we see pretty frequently in kids with trauma in their background. The last two bullet points are related, and that is problem solving, which is actually a part of the executive functioning. So problem solving brings together many areas of the brain to both understand a problem and a challenge and come up with solutions and then implement those solutions. And the executive functioning is the part of the brain and the function of the brain that allows that to happen. And so things like initiating and inhibiting behavior, planning, organizing, figuring out what's a priority, what's not a priority. All of those are things that are affected significantly by trauma. And so you can see that both in the school environment and life in general, these kiddos are going to have trouble functioning well and making good decisions because of some of these deficits that we see from trauma. So what do we do about this? That was a lot of bad news that I hate to share with you, but if we're going to take care of kids and help them when they have trauma in their life, we need to know what the impact is. And so I want to spend a little bit of time talking about what we can do in response to it. And I think a place to start is changing our fundamental question. Because what tends to come to mind when we're dealing with a kiddo that is having problems in the school environment is basically like, what's wrong with this kid? And how do we fix them? But that question often doesn't lead to solutions that work and often can make the problem worse because we end up blaming the child often for things that they don't really have good control and sometimes any control over. And so I think a better question that we need to ask ourselves is, what does this particular child need to reach their potential? Because every one of these kids, even with significant issues, has potential, and they're often functioning well below that potential. And if they're given the things that they need, they can begin to reach that potential. And that's a major function, I believe, of the educational environment. And it's why people that got into education got into it in the first place. And so let's talk about the kinds of things we can do to maximize that function. So I want to look at that at two different levels. The first level is kind of at the whole school level. And so as you think about the whole organization of a school, there are a number of different services and programs and policies that are in place to help kids thrive, to help them reach their potential. And kids with trauma are going to need more of these services and supports. And one of those is going to be counseling service, which is, one of the obvious things, but it's often not considered because people are often over-focused on the behavior and not recognizing, hey, this kiddo's got some underlying issues that counseling might really help them begin to address well. And so at the school level, that's one thing I would always consider with a kiddo with trauma in their background is what kinds of counseling services and that may be helpful to them to help them reach that potential. Another one that often is really necessary is, what kind of safety and crisis planning occurs before a crisis happens or before the next crisis happens, so that you're ready to deal with a kiddo melting down or becoming aggressive or running off from school. So those safety plans and how to handle crises is a really key component of helping these kids reach their potential and often avoiding things that would be both damaging for the kid and the school and other kids. Actually a part of that would be behavior plans. So part of an individual education plan might be a behavior plan that involves identifying the particular problematic behaviors that a child has and what kinds of things might be helpful for them in those situations. And so those can be fairly straightforward and simple, and they can often be pretty detailed. But it takes, the treatment team to really come up with some good strategies that can help a kiddo both avoid problematic behaviors, but also to address them when they do show up. One of the things that these kiddos often don't do well is manage their own emotions and their own needs very well. And so teaching kids how to have self-care plans, how to do appropriate self-care, how to recognize when they're having difficulty, how to ask for help, and what kinds of things they can do to help themselves calm down and address the needs that they have is really a key component to helping kids succeed in the academic environment. Lastly, I think is really a combination of all of these things, and that is really having a clear case management process and a person or people who are responsible for managing a kiddo's challenges and their needs over time, because those may change and they may get more intense or less intense, and you need kind of active managing of that process, of that case, to do that well. So those are things that at a school level need to be considered to help kids with trauma in their background. So let's talk about what we can do to help kids with trauma at the classroom level. The thing that I want to start with is the idea of positive relationships. This is probably really the foundation of how to help kiddos with trauma. And it's one of the most challenging as well, because of all the stuff we've already talked about how trauma affects kids. It can be really hard to have good, positive, healthy relationships with. But any effort you put in that direction also bears a lot of benefits. And so any activities that can help you form a bond that increases the trust you have with that kiddo is going to be really helpful to them and to you ultimately as well. Another thing you can do in the classroom is to really think about the space and make it a positive, warm, and helpful space to them. Having kids have access to calming activities or sensory input kinds of objects can be really helpful, as well as just having a friendly environment that's interesting and inviting for kids. And so think about that as you think about helping kiddos with trauma. This third one is called positive priming. And this is the idea of paying attention to the ways in which you interact with a kid and the activities that you have them do in a way that helps set them up for being in the most positive frame of mind and emotional state that they can be in. So there's different kinds of kind of practices and activities you can do that really help kids start off on the right foot. And if I wish I had more time to go into some of the specifics of this, but I'd really encourage you to take a look at this idea of positive priming activities in the classroom. And I think you'll find a lot of really helpful things, not just for kids with trauma, but really all kids, but especially for them. Fourthly, I'd encourage you to think about working with kiddos to identify what are their strengths of character. Each kid is a combination of strengths and weaknesses, things they're good at, things they're not so good at. And so helping them identify that and feel good about that is a really key part of helping them reach their potential in the classroom and out of the classroom as well. Lastly, I encourage you to think about what kinds of things you can do to help a child build resilience. And what we mean by resilience is that ability to recover from a stressor or a difficult event, to bounce back to a good place. And that takes some practice and sometimes some explicit teaching of emotion management skills, sometimes of self-calming, self-soothing strategies. All of those things can help kids be more resilient. And that's going to pay off not just in the classroom, but throughout their lives as well. So those are just some ideas about ways to really help kids with trauma in the classroom. The final thing I wanted to cover with you is just a recognition that when it comes to helping kids with trauma, you are the most important thing that you can use to help them. That you being the best version of you is one of the best things you can do. So what can you do to do that? Well, one, practice good self-care. So do a good job of taking care of yourself physically, emotionally, spiritually. There's a lot of information out there about good self-care, and doing that will help you show up ready and capable to help kiddos when they're really struggling. Second, I'd really encourage you to maintain an attitude of learning. We've learned a tremendous amount professionally and through research about trauma and how it affects people and what can help them heal and function when they've had trauma. So keep learning. You've spent time learning today, and I'm hopeful this has been helpful, but there's so much more out there. So keep looking for it and giving yourself that opportunity to benefit from more information about trauma in kids. Thirdly, I'd say, man, remember that you need to be part of a team. Nobody is going to have all the knowledge that's needed or the energy to really help a kid. And so, man, think about who your team is and be quick to ask for help or input or ideas and really approach caring for a child as part of that team rather than the Lone Ranger. And you're always going to do better in that context. Finally, I'd encourage you to really hold on to hope, even though, again, we talked about some pretty tough news about how trauma affects kids and that it can be very long lasting. Man, there's hope that kids can grow and mature and get stronger and learn new strategies. And so if you're hopeful and you keep pointing them toward getting better and growing, they're going to get there. So hang on to that hope and keep doing what you do. So to that end, I just want to say thanks for everything you do to take care of our kiddos, especially our deaf kiddos, and the ones with trauma who are far too common. And thanks for hanging in there and learning and taking good care of them.